Hi everyone, my name is Wisdom Aimbuna Pusiga. I'm an advocate for viral hepatitis and I'm with Impact Mission Ghana. I've been doing this advocacy for close to 5 years, and throughout that period, people constantly reach out to us through phone and other means requesting for very critical piece of info on viral hepatitis. So this year we thought it wise to make it one of our flagship programs to do videos that are very educative to the general public. So in the coming weeks, you'll be seeing lots of these videos. When you come across them, kindly like, share and subscribe. Thank you very much. Talk about hepatitis, we are talking about inflammation of the liver. Inflammation of the liver can be caused by a variety of factors. We have viruses, we have bacteria. The liver can even fight itself, what we call autoimmune. People who take alcohol can also cause distraction to the liver because of the critical function the liver plays. But when we talk about viral hepatitis, we are very specific now. We are talking about inflammation of the liver caused by viruses. And the common viruses identified to cause this viral hepatitis are hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. The very common in our settings are hepatitis B and C. So in the coming weeks, we'll throw more light on hepatitis B and C. When we talk about hepatitis B virus or hepatitis B infection, we are talking about an infection caused by the hepatitis B virus. Statistics have shown that about 400 million people are living with hepatitis B globally, and about 800,000 of them die each year. When we come to Ghana, the statistics is not also so good. WHO categorized Ghana as being highly endemic with the virus, with a prevalence of 8% or greater than 8%. Another research study by Julius Agbesik and his team of researchers also found out that the prevalence of hepatitis among our population is 12.3%. Literally, this means that when you screen about 100 people, you are likely to get about 10 people testing positive for hepatitis B virus infection. This is how prevalent the infection is. This is how common the infection is amongst us. And this is the more reason why everyone should take action to prevent the spread of viral hepatitis B. Thank you. When we talk about mode of transmission, we are talking about how can someone get the infection. One can get hepatitis B infection through direct exchanges of body fluid from an infected person to a non-infected person. The body fluids that have been identified to transmit this hepatitis B infection are categorized into three. We have those that contains high levels of the virus, those that contains moderate levels of the virus, and the others that contains low or not detectable or not at all. So when we talk about the high levels of the virus, according to Center for Disease Control, CDC, they made mention of blood, serum, and discharges from the wounds. These contains very high levels of the virus. So when you have direct contacts with these blood, serum, and all that, your chance of getting the infections becomes higher. When we talk about moderate levels of the virus or body fluids that contains moderate levels, we are talking about saliva contains moderate, according to CDC, vaginal fluid, and semen. This contains moderate levels of the virus. So what it means is that these body fluids can transmit the infection, but they contains moderate levels of them, and that also depends on the person's viral load. When we come to the low or non-detectable body fluids, we are mentioning sweat, tears, feces, urine, and breast milk. So what it means is that these ones, it becomes very difficult for one to transmit body fluids through those are just mentioned as low or non-detectable. So for instance, there's a myth that if you even shake somebody's hand, you can get hepatitis B. These are all myths, they are not true. If you hug somebody, you can get hepatitis B. If you exchange shares with somebody, you can get hepatitis B. These are all myths. Others too who say when you hug somebody, you are going to get the infection. These are all myths. Exchanges of cups, because saliva contains moderate levels of the virus, there could be a possibility of what? Transmitting the infection. But this has to, there should be other factors, like when there are cracks in on the lips or bruises in the inner linings of the mouth. These are all things that could what? Play out for saliva, for one to get the infection through saliva. So ways that you can get this infection has to do with sexual intercourse through the body fluid, so exchanges of vaginal fluid and semen. We can talk about sharing sharps like needles. In a family, we have people using one blade, cutting everybody's hand, and there are these guys from our neighboring countries who are here practicing something. I don't know whether it's manicure or pedicure. Because sweat contains low or non-detectable levels of the virus, the myths that when you shake somebody's hand or hug somebody, you can get the infection is flawed already. So it's false, that it's a myth that shaking hand or hugging somebody who has the infection, you can get it. These are just myths. And we have also encountered severally that children who are born to hepatitis B positive mothers are denied of breastfeeding. And this is because it is believed that children can get the infection through breast milk. But studies have shown that breast milk contains low or non-detectable levels of the virus. So I believe this has been very educative enough. So sexual intercourse, you can exchange the body fluids through sexual intercourse. People who share sharps like blade, and I've seen some gentlemen going around from our neighboring countries who are going around cutting people's fingernails and toenails with a common instrument. These are all ways and means that you can get this hepatitis B infection. Other people, health workers, are already at risk. We have sex workers, they are all at risk because of the sexual intercourse. And drug users, multiple drugs because of the multiple injections. These are all people who are at risk of what? Getting hepatitis B infection. So I believe this has been very informative, and so some of the myths that we held on to about what causes hepatitis B, we will move away from them and also educate people rightly. So thank you very much as we move on to our next educative piece.